Good evening, everyone. I'm Dr. Marty Ross, and this is another conversation with Marty Ross MD tonight. As you know, this is a webinar where we're going to discuss Lyme disease. And as usual, no 2 weeks are the same. You create each of these webinars with your questions. And I am very interested in seeing what you have in store for me tonight. So tonight is our last in a series of 4 webinars, and then next week I will be taking off. Sometime tomorrow morning, as usual, I am creating a recording, and in the morning, I will send you out a summary of what we talked about. It will also have timestamps that you can use to watch the video again on YouTube if you need to do that. And then also with that email in the morning, you'll also have a chance to sign up for the next series of webinars that begin in 2 weeks, okay? The one thing I request that you do, help me to reach more people. So if you could forward these emails on to other people you think may get benefit, either the recordings or the invites to the webinars, I'd really appreciate that. I invite you to help me do that, okay? So for those of you that are coming back again, I'm glad to see a number of familiar names on my message board. And I believe that means you're getting some value out of this. For those of you that are coming, that are new here, I want to talk to you about how you participate. So there's a couple things you could do. Number one, you can see what questions other people raise and how I respond to them, okay? And I look at every question as a chance to learn something, to teach something. So I will go beyond just exactly the words that somebody asked, but try to expand it into something more understandable for everybody, okay? All right. Second thing you can do is go bold on your first time, and you could write a question. And the way you do that is in the chat box. The only thing I request is that what works best for this format is to do shorter questions. Okay. All right. And then during the course of the webinar, if you are in the live version, I will post the questions on the screen so you can see them. But if you happen to be participating in a recorded version, you will not see those written questions. So I'll read them out loud here as part of the webinar tonight too. Okay. So without any further ado, let's go ahead and get started here. Hello, Brandy. Let's see. My current white blood cell count is 3.7, and my doctor is not concerned. What is the number when there should be concern? Is there anything that can be done about it? After 4 separate attempts and a lot of runaround, I have not been able to get any sample testing or validation information from the Jona stool test company. Use with caution. My experience in the past is those samples get thrown in the trash and the results are auto-generated. All right. So first of all, about the Jona stool test, I've actually had good experiences. My patients are all getting their results back, and I have not seen anything happen bad. So if you've had a bad outcome, you need to work that out with them and find out what happened to your sample, okay? So that has not been my experience at all. I've actually am getting very useful information from them. So anyone, Jona is a stool testing company that is doing a very unique way of looking at your stool that I consider to be more comprehensive than any other stool testing companies out there. And specifically, their tool to see what is in your stool and what makes up your microbiome is more expansive, and you get bigger results than you would with other vendors. So what Jona does in terms of trying to figure out what microbes are in your intestinal microbiome is they take the stool sample and they basically cut it up into all the different genetic sequences. And then they go ahead and see, well, what does that correspond to using an AI database? So they're able to see what's in there, okay? That's different than other stool testing companies that basically those other stool testing companies are only looking for a limited number of organisms, maybe like 40 or 50, for which they've created a genetic probe that will attach to that organism that's there. But what those other stool companies don't look for is the other things. They don't have a way of looking at that, okay? So Jona does have a way of doing that. Jona also takes your stool test results and looks at the makeup relative to the illnesses that you might have, and then makes recommendations about probiotics, diet, lifestyle changes that you might make to improve your health condition. And they're doing that using this expansive database now of stool testing information or research out there that's growing almost daily. We get new articles, new research studies on the importance of the intestinal microbiome, and so they're tapping into that to guide their findings. Okay, all right. So, and then the second thing, in terms of a white blood cell count of 3.7, so that number, although it is slightly low, is enough for your immune system to fight infections. And I, like your providers, am not too concerned by that. What I will tell you is that often as you treat for your tick-borne infections, if that's what you have, or if you have mold toxicity, that suppression of your immune system will lift. And often as somebody's getting better, those white blood cell counts go back into the normal range. It probably has something to do with immune suppression from having the infections. But at that level, I would not, I don't think it's hurting your ability to get over infections. Okay. All right. Good luck to you, Randy. So for those of you that are interested in that Jona stool test I was just talking about, you would go to Jona.health, Health. So Jona.health, Health. Okay. All right. Hello, Narma. Let's say hello, Dr. Ross. I have two questions for you. One, is there anything for biofilms fibrinousness breaking down that doesn't affect homeostasis, does not have thinning effect on blood for people with worsening clotting disorders? What do you recommend to take? Number two, I think, is what do you recommend to take for tachycardia, heart racing, palpitations when somebody is on rifampicin after ivermectin failing? I'm considering trying beta blockers, those that bypass liver, or have I focus on POTS dysonia? Okay, so we'll try to decipher what you mean by that last part of the question here in a minute. Let's talk about the first part of your question. So there are two things that people can get in Bartonella that can limit your treatment, and that would be biofilms that cover your germs, which is a slime layer that's held together with blood clotting proteins called fibrin. Okay, and that can cover your Bartonella. We also see biofilms occur in Lyme, sometimes even in yeast infections as well too. Okay, all right. And then the other phenomenon that can happen in Bartonella and in Babesia is that these germs have the ability to wrap themselves up in your blood clotting protein, creating what are called germ fibrin nest, basically. And these germs wrapped up in fibrin stick themselves on your blood vessel walls, and they become harder for the immune system to get into, but also for your herbal or prescription antibiotics to work on. So one of the central ways that we deal with these is to put you on agents that break apart fibrin. Okay, all right. And fibrin is needed for blood clotting. So if you are also on something else, if you already have a clotting disorder that thins your blood, or if you're needing to be on other agents like Eliquis, for instance, to prevent blood clotting, then it's probably not a good idea to be on agents that break down fibrin. So your fibrin breaking down agents are called fibrinolytics. One of the big ones we use within tick-borne infections is lumbrokinase. You can also use nattokinase. You can use serrapeptase. Those are your big enzymes, okay? All right. So for the fibrin nest, I don't have another alternative because you have to break down the fibrin, and that means you have to use a fibrinolytic, and you don't want to use a fibrinolytic if you happen to be on something like Eliquis or some other kind of blood thinning agent. So there is not an alternative that I can recommend to deal with the fibrin nest, okay? But for biofilms, there are non-enzyme treatments that can help break down biofilms. And one of the products I like using that has no enzymes in it is a product that is manufactured by a company called Biocidin Botanicals, and the product is called Biocidin, okay? So Biocidin has a number of useful purposes, actually. It often can be helpful at changing the germ load in small intestine bacteria overgrowth. It has some agents in it that support lowering yeast within the intestines as well too. But it's also got a number of agents in it that alter biofilms. And so Biocidin is an herbal compound that has, I think, about 10, maybe 12 different herbs in it. But collectively, they work together to block a number of the things that happen in biofilms to cause them to fall apart. So number one, they make it so biofilms are less sticky, so they have a harder time attaching. Number two, they block something called quorum sensing, which is a signaling mechanism that one biofilm will use to talk to another to try to get them to grow together, okay? They kill organisms within biofilms, or may kill organisms with biofilms that may cause them to fall apart. Okay, so those are just three things that that it may do. So the only thing I can offer you is an alternative to go after biofilms. I cannot offer you an alternative to break up your fibrin nest. There just isn't a way to do it if you happen to be on blood thinners. Okay, so if you are trying to break apart biofilms in you, the form of biocidin I would use, there's three products. There's one called biocidin LSF, which is a liposomal product. There is also a liquid drops, and there are capsules. I tend to find the capsules and drops stay more in the intestinal tract to deal with issues like SIBO or yeast, versus if I'm trying to use it as a biofilm, anti-biofilm agent, what I like to do with it then is to have people take it as the biocidin LSF and work up to a couple pumps 3 times a day on that. Okay, all right, that's how I handle that. And then so I'm trying to understand this, what you're trying to get at with the second part of this question. I think you're asking what to use to block the palpitations. So, if palpitations are significant on rifampicin, one of the easiest things to do is stop it. We have plenty of other options to deal with Bartonella. You don't necessarily have to be on rifampicin to get rid of Bartonella. Okay, so that would be one thing I would consider, although I'm not your doctor, so you need to talk to your doctor about this. But if you were my patient and you were having lots of palpitations on rifampicin, one of the things I might consider doing if it was significant is consider getting off the medication. Okay. Number two, sometimes you can decrease a lot of these palpitations by increasing magnesium. And so you could do a magnesium. Probably for this, I might do a magnesium glycinate, and I would try to take about 300 milligrams a day, maybe 300 milligrams twice a day. But magnesium will decrease irritability of the electrical system and even the muscles within the heart as well too. So that would be something that could help with that as well too. Okay, all right, and then let me see here. So I'm not sure whether your arrhythmia or heart skipping around is a side effect of rifampicin. Is it a magnesium deficiency, or is it because you also have some form of dysautonomia, imbalance in your adrenals? In your adrenaline, anti-adrenaline systems. And to help figure that part, I need to ask you a lot more questions. All right. So I think I'll just leave my response to what I did already here. Okay. All right. Good luck to you. Hello, David. Let's see. Hi, Dr. Ross. I take 1.5 milligrams low-dose naltrexone in the morning. I take 0.25 milligrams alprazolam and 2 milligrams melatonin bedtime. Is it okay to take 100 milligram itraconazole sometime later in the morning? I'm just concerned about RX conflicts. Yeah, so I don't see. So first of all, itraconazole and low-dose naltrexone (LDN), I don't see potential interaction problems there. It is true, itraconazole may alter metabolism of alprazolam, probably not the melatonin though. So you may want to take those in the morning, but you could even take it at the same time as your low-dose naltrexone. Okay, all right. Good luck to you. So for those of you that aren't familiar with low-dose naltrexone, I'm just going to point you to an article that you can read about it. It is something we can use to control pain, especially fibromyalgia type pain. It is also useful in mast cell activation syndrome. and it is useful at regulating your immune system and immune system imbalances too. So you can learn, I may say more about it later, but you can learn more about it in my article called Low Dose Naltrexone. Okay, talk about what it does, how it works, how you dose it, etc. Okay. All right. Good luck to you, David. Hello, Eloise. Let's see. Hello, Dr. Ross. What would be your recommendations after being bit by a tick while awaiting tick testing to see if it carried Lyme? Apparently, ticks are very present this year in Washington. So I'd like to have the basic protocol steps, herbal on humans for my family, just in case. Thank you. All right. So I'm trying to figure out how I can answer this. So first of all, if a tick is carrying Borrelia, time is of the essence, all right? And I probably would not wait for tick testing to come back. In addition, tick testing is not perfect. So you could have a negative tick test and might still have the ability to transmit Borrelia, okay? So when it comes to when somebody gets bit by a tick, we could use antibiotics to help prevent Lyme disease. And by that, I mean Borrelia Lyme infection. We don't use the antibiotics to prevent Babesia and Bartonella because usually if you catch those acutely, they're not going to go on and cause chronic problems, okay? That's just what the general guidelines are out there, all right? But the main reason we're doing this is that Lyme can be insidious, can be there for years before somebody has any problem. So we're trying to prevent that. Now, it just so happens the antibiotic that we would use to prevent Lyme in an acute situation can block Bartonella from establishing, can block Babesia from establishing, can block anaplasma, and can block Ehrlichia from establishing. Those are other tick-borne infections, all right? So for asymptomatic tick bites, if you've been bitten by a tick, the recommended prescription antibiotic is doxycycline, 100 milligrams, 2 times a day for 20 days. And that is based on mouse studies that show using a similar dose in mice for 20 days prevents Lyme disease from establishing, okay? All right, and by that I mean Borrelia, okay? And it just so happens, as I said, if you use doxy in that kind of a setting, that likely will shut down Bartonella Babesia. It definitely handles Ehrlichia and anaplasma as well too, okay? All right. Now, if in terms of recommendations about when to use antibiotics for it, some of that depends on where you are in the country. So in areas where we know that ticks predominantly carry a lot of Lyme, like out in the East Coast, where I think Jersey is 90% of ticks carry, or 95% of ticks carry Lyme, in areas that are thought to be high prevalence, I think you just absolutely give antibiotics, all right? In areas of the country where Lyme has lower prevalence, some would argue that you should not give out antibiotics for asymptomatic bites. Now, I don't agree with that, okay? Personally, I think you should probably be on doxycycline for any kind of an asymptomatic bite wherever you are in the country. That's my own personal belief. It does not fit with everybody else's guidelines out there, okay? Is there an adequate substitute to use herbal antibiotics? And the answer is we don't know. No one's done studies to know in an acute situation when you're trying to prevent Lyme from setting up, does cat's claw or does Cryptolepis or does Japanese knotweed prevent those infections? We have no studies. Our best studies still to this date are for using doxycycline. Okay, now, if you have a tick bite and you have symptoms of it, that's a different ballgame, okay? So if you either get a bullseye rash or you have temperature, you've got achy joints, you get fatigued, that is Lyme, okay? That's called Lyme disease, right? And acute Lyme, how you want to treat it is for at least 6 to 8 weeks with doxycycline, okay? So my comments earlier were only about asymptomatic bites, okay? Now, You may not be able to find a doctor willing to prescribe doxycycline for an asymptomatic bite in Washington State, because out here we don't have any hard data that tells us what percent of ticks carry Lyme. We do know it's out here. We just don't know how much. We know, for instance, I believe it's down in Northern California, it's about 30%, maybe 40% of ticks carry Borrelia down there. We're on the bird flyways where ticks jump on birds and they fly up here. So maybe we have that kind of percentage up here, but nobody's done the studies. As an alternative, if you can't get doxycycline and there's nothing else you can do, then you might want to try doing probably I would do a Cryptolepis and cat's claw. And the reason I would do that, cat claw we have just most extensive experience with. Cryptolepis also, so cat's claw would be really good for growing and hibernating Borrelia. Cryptolepis would pick up Bartonella, Babesia, and also helps with Borrelia as well too. An adult dosing on those, I might look at 30 drops twice a day on a cat's claw, and on a Cryptolepis type tincture, I might look at doing 30 drops 3 times a day. Now, I want to be very clear. There is no science behind using herbs in an acute setting like this, though. Okay? All right. If you want to see an article that I've written more about this, about what to do with acute bites, let me just show you that here. So it's right here, acute tick bite. Okay, and this is where I even review the science so that you can dig into this a little bit more too. Okay, all right. Good luck to you always. Hello. Oh, let's see here. Hello, Thomas. I know you are not a big proponent of parasitics, but I was CDC positive for Lyme, Babesia, and BARD after being bit by a feral cat that also had every worm imaginable and ultimately died. I have a voracious appetite and still managed to lose weight with burning skin. Are parasites something I should consider? I do not have a swollen belly. So what I would say is I do believe in antiparasitics for Babesia. Okay, so Babesia is a parasite, and as you all know, I do believe in treating for parasites. I do think if you have been exposed to parasites, then so what my feeling about antiparasitics is in situations where people think I'm not getting better, it must be a parasite. Okay, they just kind of come up with that idea because somebody wrote about it on the internet or Dr. Klinghardt thought it was a good idea to do. And what I've said before is I don't think that that is warranted. I don't think there's any data that says when people aren't getting better that it is due to parasites. However, if you've got exposures to parasites, that might change the equation. Okay, so I'm talking people that don't have any known exposures. You're talking about an exposure here. If I were to be evaluating you, I'd have a lot more questions to ask because not being able to put weight on may have other problems. It could be due to thyroid illness, for instance. I would want to explore with you what else is going on besides parasites. I would also consider doing stool testing to look for parasites. And if there was still a possibility of systemic parasites of some kind, I would probably want to do some blood studies for those, but I would need to investigate a little bit more what I'd be looking for before I ordered those studies, okay? So that I just want to clarify, you have a different situation. When I talk about not being for random treatment of parasites, this opinion that some people now have out there that if you're not getting better, it must be parasites, I don't think there's any foundation behind that. You have a different situation though, okay? All right. Good luck to you, Thomas. Hello, Jane. Hold on here a minute. Hi, Dr. Ross. You helped me to get diagnosed with Lyme disease in 2014. Thank you. Wow, it's been a while. You're welcome. Let's see. I was better for a few years. In January of this year, I took a trip to Northern California where I contracted HMPV and was also bit by a tick again. I have not felt well since. I did 3 rounds of antibiotics, 10 days of doxy, 5 days of amoxicillin, 5 days of azithromycin upon my return, and subsequent development of the HMPV virus morphing into pneumonia. After that, in mid-March, I was tested for 7 tick-borne diseases through Armin Labs with the Elispot test. All came back negative. My CD57 was 75.86, so still within normal range. My question is, could it be possible the test can be a false negative? So the answer is yes, they could be. All right, so let's talk about, so first of all, I think many of you, I'm just going to frame something here to begin with. We, in terms of trying to, well, I'm not going to go there. Let me go a different angle here. So when we look at testing, there are both what are known as direct and indirect testing. Okay, direct means you can see the germ. So you can either do a microscope exam after putting a fluorescent marker on that germ. We call that fish testing through IGeneX, or that's the method that T-Labs does. Okay, they apply a marker to the germ that fluoresces so they can see it at a microscope. That's direct, you can see it. Other direct testing methods are called PCR tests, where we're looking to see if you have the genetic material of the germ in you, okay? In general, the problem with direct tests, so that when they come back positive, it's very likely the germ is in you because you can see it, okay? The trouble with direct testing, and for instance, and I'll get as an example, the Lyme PCR study will only find Lyme if you have it 30% of the time, okay? A large reason that it's hard to find these germs by direct testing, especially with Bartonella and Borrelia, is that these germs live in your tissues or in your cells and not necessarily floating around your blood. So it's a sampling issue, okay? Babesia may be a little bit better, but for direct testing. However, no one's done studies to tell us how accurate direct testing is, microscope or PCR testing for Babesia and acute or chronic situations. We just don't know, okay? All right, then indirect testing is we're looking to see if you have an immune reaction, all right? And they fall into 2 camps there. One is antibody testing. That would be your Western blots, your ELISAs, your immunoblots, okay? All right. And then the other way to do indirect testing is to look and see if your white blood cells, your T white blood cells, have tried to attack a germ in you, all right? And what we're looking at specifically is we're trying to measure activity in what are known as your circulating T cells. And the thing that's unique about circulating T cells is they only live for 2 months. So if your Elispot comes back saying your T cells reacted against a germ, that means that germ was probably in you in the last 2 months. So some doctors will try to use Elispot testing to see if you actually have active infection going on, all right? There's some problems with that though. So number one, if you have immune suppression going on, an Elispot may be negative, even though you may be raging with having a lot of germs in you, okay? All right, so you can have false positives or false negatives because of immune suppression, even with an Elispot, okay? Number two, Armin, is this Armin you did? Yeah, Armin. So both Armin and Infectolab are the 2 ways to get Elispot testing here in the States. Armin is pretty much in Canada. Armin, but anyhow, those are the 2 labs that will do your Elispot testing, and both of them have limitations. So number one, when it comes to testing for Borrelia, they're only looking to see if you have activity against proteins found on Borrelia burgdorferi, not the other 7 strains that we think can infect people here. Now, Armin also is looking to see if you have a reaction against Borrelia afzelii and Borrelia guerinii. Okay, so the 2 European strains that Armin's looking to see if you have reactions against burgdorferi, which is the big US strain, afzelii and guerinii, okay? Infectolab, I believe, is only looking for burgdorferi, but we do think there's 8 strains that can infect people here in the States. So a negative from Armin may mean immune suppression, or it may mean it just doesn't test for enough against enough organisms, okay? And then for both Armin and Infectolab, when it comes to Bartonella, they're only looking to see if you have activity against Bartonella henselae, but we think there may be up to 15 different Bartonella strains that can cause problems for people. And so they're limited versus the immunoblot antibody testing from IGeneX is looking to see if you have antibodies against the genus, and therefore they're looking to see if you have antibodies against any one of the members of the Bartonella family. So it may be a better screening test, for instance, okay? Right. And then when it comes to Babesia, Armin is looking, I believe, at Babesia microti only, and Infectolab, maybe microti and decani. I think it's mainly just microti though. And the issue there is we think there's about 15 strains of Babesia as well too. And so they're limited, okay? So what I would say is a positive Elispot does mean something. It means that in the last 2 months, your body's been trying to fight that infection, all right? So it could be some evidence of it being in you. But it could be negative because of immune suppression. There's validation studies tell us that Elispot testing is inaccurate about 15% of the time, actually, all right? And then the problem with Armin and Infectolabs is they're not looking at enough of the germs for Borrelia, enough of the germ types for Bartonella, and not enough of the germ types for Babesia, okay? All right, so let me just do a quick screen share here because I think I laid this out with some more detail for you. Okay, so I have written an article called The Best Test. There it is, where I kind of explain some of these concepts. And I'm just looking here. Okay, so Armin does test for Burgdorferi, Afzelii, and Guerinii on Borrelia. They only check for henselae for Bartonella, and they only check for microti for Babesia, okay? Infectolab does Burgdorferi only for Borrelia and then does henselae for Bartonella and microti. Okay, so that's why these tests are limited. They're just missing stuff. Okay, all right. Let's see here. So Jane, if you want, in trying to determine what's happening with you, sometimes it just helps to sit down with a clinician that's dealt with tick-borne infections for forever. I guess I would describe myself that way these days. But sometimes it's just how you can pick out in situations where it's not clear. Sometimes you have to, based on symptoms, detailed questioning about exactly what's going on with you, sometimes clinically, not laboratory-wise, but clinically, I can get a sense of whether it's a Borrelia reactivation or new infection, or a Babesia or a Bartonella new infection or reactivation, okay? So consider that. I'd be glad to help. I don't know if you want to come back and see me again at all or not, but if you want to do a telemedicine or a remote visit with me, I'm open to doing that with you as well, okay? So everyone, I do consult. I do help people from across the country and the world. And if you're interested in looking at how you would do that with me, let me just do a quick screen share here so I'll show that to you. Okay, so this is my clinic website. My clinic is the Marty Ross MD Clinic for Functional Medicine and Lyme Disease. And if you're interested in knowing how to see me, just click my book appointment button here. And then I'm offering two options. One is full service in-clinic care, where to establish care with me, you have to come out here and see me in my office, okay, at least once, okay? And then there's a remote consult visit where I will give you opinion, but I can't do a formal diagnosis and I can't prescribe and I can't order your test, but I can tell you what I think is going on, okay? So that might be something you want to look at. With this in-clinic care option, I can prescribe, I can order tests, and I can make formal diagnosis, okay? So take a look at either one of these for yourself too, okay? All right. Good luck to you, Jane. Hello, Sally. Let's see. Is high cholesterol typical with Lyme disease and other infections? You know, it's a good question. I haven't seen any studies that tell us that it is. Okay, I don't think anyone has scientifically looked at that question before from a laboratory standpoint or research standpoint. If we look at mechanisms of inflammation, though, there are some reasons to believe that in inflammatory conditions, cholesterol will increase. There's reasons to believe that. Now, that doesn't mean that's what happens in people living with tick-borne infections, but there's reasons to believe that it could be a factor in it. Okay? All right. Good luck to you, Sally. Hello, Angela. Hold on here just a minute. Let's see. What are your thoughts on using a Rife machine for Babesia oticoli specifically? I likely have other co-infections, but I'd like to get rid of this first. Would I need to take a fibrin nest buster as well? Should I take herbals while rifing? Okay. So let me talk about rifing. So rifing, everyone, involves using a machine that generates electromagnetic frequencies. And the thought is they're generated at a frequency that is thought to vibrate with the germ in a way that will burst the germ. That's in theory how a Rife machine is supposed to work, okay? The problem, I will just give you some caveats here too. There are no safety studies about these, okay? So for that reason, the FDA and maybe even the Federal Trade Commission do not like that we talk about them. So I'm just warning you. I'm just letting you know. I can't validate that these are safe to do. All right. So I just have to throw that out there. That's my boilerplate on that one. All right. What I have seen in my practice is, and then one other thing. So the thing that in theory is useful in rifing is that you have to find frequencies that are thought to vibrate your germ and kill it. All right. So what I mean by vibrating, you probably have seen the example before where you take an opera singer will sit in front of a glass of water and they can sing in a way that their voice resonates with that glass and they burst it. It's the same idea with rifing. In theory, that's what the same idea is. Okay. Now, in my experience, I have seen that people who add rifing to regimens that I suggest, about 35% of them, maybe 40% get some improvement. I have never seen anyone in my practice that had complete resolution of their tick-borne illnesses by rifing alone, okay? So I'm reflecting in my practice, okay? I'm going to show you an article here too, because I want to show you that there is a group, and let me just do this here. There is a group that is known as LymeDisease.org. They're based out of California, okay? And they have, let me see how I can find this. They have a project called My Lyme Data, and they're using My Lyme Data to periodically ask people about what different questions. And so a number of years ago, they went and asked them what's working, and they looked specifically at a number of alternative therapies. Okay, so I write about that here in this article. All right, and if you want to see their data a little bit more, you could go to their website here. Okay, but this is from there. I apologize for how small this is. Let me see if I can make it bigger for you. All right, so their data on various herbal, and again, this is people that had tried these and they asked them, what was your experience? All right, so Rife machines, about 35% of people said moderate or very effective. That's what the My Lyme data says, okay? But 28% there were moderate or severe side effects, okay? So this is My Lyme data, that's what it shows. And what I say is this 35% that I just talked, that I said is basically also what my experience is within my clinic as well too, okay? So just keep that in mind. It's probably not going to be the thing that gets you all the way there basically, all right? All right, and then in terms of whether I think it would work, in theory, even if the germs are within a fibrin nest, in theory, you would think a Rife should work. Again, I don't know. No one's done the studies to tell us. Okay. All right. The other thing I would point out about people, about 35% saying it's moderately or very effective, keep in mind that there's something called a placebo effect. And anything that we give you, about 35 to 40% of people will say it works. If they're in a trial and they're given a placebo versus people that are given the real drug, for instance, about 35 to 40% of people in the placebo group will say they get the same benefit as the people in the drug group. Okay. So a placebo effect, I call it a healing effect, is real. That's the fact that if I'm taking something for an illness, I will get better. Maybe it has nothing to do with the biochemical nature, the biochemistry, the vibration. It's just the act of doing something, which is what a placebo effect is, makes you feel or gives you improvements. Okay. So I don't know if these 35% of people that came into my office that felt better rifing, or those 35% of people that felt better rifing, that they reported what they were doing to my Lyme data. I don't know if that's a placebo effect or not. Okay. All right. And could you take herbals while rifing? You could. Just be aware, people describe that when they rife, they can get some pretty significant Herxheimer reactions, okay? And so being on herbal antibiotics increases that chances as well too. So you might, if you're going to do this, I would probably suggest starting either herbals or rifing first. Get set up on one of those ways first. Know that you're handling it from a Herx standpoint before you put the other ones in, okay? All right. Good luck to you. Oh, I think I have a whole article on rifing as well too about how you do it. So let me just go back here again. So there are resources out there about how to rife and how it's supposed to work. And take a look at my article that I wrote here about it, and with some resources that you might want to look into as well. Okay. All right. All right. Good luck to you, Angela. Let's see here. Tell you what, everyone, I think all of you know I had knee replacement about 7 weeks ago, and my knee is not being nice to me right now. I'm going to stay here, but I just need to get up and move and take a quick walk, and I'll be right back. Okay, I just need to move it. All right, I'll be right back. Okay, I hope that gets me another half hour or so. We'll see. It's got a life of its own, unfortunately. My rehab is going a little slower than I want, but we're making headway. But every now and then it just jumps on that knee a little bit. All right. So hello, Dawn. Let me put your question up here. Let's see. Hello, Dr. Ross. I was just diagnosed today with Lyme and Bartonella and mast cell activation syndrome. I'm in New Jersey. I'm very overwhelmed because I have symptoms like bad muscle aches and joint pain and digestive problems and tiredness. I'm very scared about taking antibiotics because I recently took Augmentin for diverticulitis. And while the fatigue and muscle pain I felt was horrible, I could barely function. Is the only treatment antibiotics? I read that Bartonella is very hard to treat. Is that true? I tested positive for the kind you get from a cat scratch. All right. So I will let you know. Well, I'll give you some opinions here. Okay. And some of this is based on, again, my experience doing this since 2004. I guess we're coming up on 22 years treating tick-borne infections. Okay. So at one time when I was treating for tick-borne infections, I believe strongly that the best way to proceed was giving prescription antibiotics. I don't believe that anymore. I think that we now, about 5-6 years ago, there was newer research that came out that was conducted out of Johns Hopkins University. And the Johns Hopkins researchers were looking to help us understand what we could give for what is being described as something called persister Borrelia and persister Bartonella. So both Borrelia and Bartonella can be in a growing state, or some of the germs will go into hibernation, maybe 10% of them. Those are called persisters. And the persisters have been flummoxing us for a while because regular antibiotics that we'd have used for Borrelia and Bartonella don't seem to do a good job against these hibernators. Okay, so what Johns Hopkins University was doing, this might be 6 years ago now, was trying to look at what could we give that would deal with these persisters. And they started even looking at herbal antibiotics as well too. All right. So we have learned, based on those Johns Hopkins experiments, some really useful information. So we now know that there's a variety of herbs that are quite useful as antibiotics against Bartonella, Borrelia, and they're useful against growing and persisters. Okay, so they give us a little bit wider of a breadth of action than what the prescription antibiotics do in a sense. Okay, all right. They also were able to show us a number of agents that are effective against Babesia, which a good one is a Cryptolepis. Okay, so based on those research studies that came about 6 years ago, many of us started adding these in, and I was already using herbals, but I've been my ideas of what to use changed because of some of this data that we got at Johns Hopkins University. Okay, all right. Now another reason that these days, so first of all, I think we have some good herbal antibiotic options. I think at the beginning, when somebody has Borrelia, the herbal antibiotic options give you as much chance for improvement as prescription at the beginning, okay? When it comes to Bartonella and Babesia, herbal options for Bartonella work about 5 to 10% less effective, but they're still pretty good. So prescription options may work about 85% of the time for Bartonella. Herbals may work about 75 to 80% of the time, but that's still pretty good odds, okay? And then for Babesia, I would say similar numbers as that as well too, all right? Now, the thing about Bartonella and about Babesia, they replicate about every 24 hours. And things that replicate every 24 hours, when you get on an agent, whether it's a prescription antibiotic or an herbal antibiotic that's working, usually you'll start to see improvements in the Bartonella symptoms or the Babesia symptoms within about 2 months. So if you were to start herbal options and you're not seeing any change in Bartonella symptoms or Babesia symptoms, by 2 months, maybe 3 months, you can still change over to the prescriptives. And relatively, in the world of tick-borne illnesses, you haven't lost too much time, okay? All right. Now, another reason I favor the herbal antibiotics is, there's two other reasons. Number one, in people that are very reactive against antibiotics, whether it's strong Herx reactions or allergic reactions, just people that are reactive, the herbals tend to give you more flexibility because you can start really low in your dosing. So like, for instance, if a Japanese knotweed dose for Bartonella is 30 drops twice a day, and somebody that's very sensitive, I might start at 1 drop twice a day and tell them only to increase the dose if they're not having big Herx reactions or worsening reactions, okay? All right, and then finally, the reason I like using herbals to start is we now have a whole new bunch of information about the importance of the intestinal microbiome that we didn't have back in 2004 when I started treating, okay? We now know that the organisms that make up your intestinal microbiome basically are the brain of the entire body. So your intestinal microbiome makes a bunch of chemicals and transmitters that help the brain work, help your immune system work, help your heart work, help your intestines work, obviously, help your muscles work, all right? So you could say that the intestinal microbiome is the brain of the body, the brain of every organ. And so I try to protect that more aggressively than I might have before. And herbal antibiotics tend to be less destructive to the health of the intestinal microbiome compared to the prescriptions, okay? So what I want to let you know is you actually have some options here where you could not necessarily go with prescription antibiotics, all right? And then in terms of Bartonella and Babesia, if you're in discussion groups, you're going to think that no one ever recovers from Babesia or Bartonella, because the people that tend to be in support groups are the people that tend to be the most difficult, having the most difficulty improving, all right? But I will tell you, my experience is about 85% of people with Babesia and about 85% of people with Bartonella will respond and improve and get better from your initial treatment. That means about 15% go on to become chronic, and those are the people we do have a harder time getting over it. But I want to let you know, if you've never been treated before, you have about an 85% chance that your Bartonella can be taken care of within 6 months. And you have about an 85% chance that your Babesia can also be taken care of within about 4 to 5 months, actually. Okay. So I want to make you aware of that as well, too. Be careful about what you're going to hear in support groups. They're heavily skewed to people for which they did not get better. You're not hearing from people in support groups, people that got better, because they're better. They're not hanging out in support groups. Okay. So just keep that in mind as well, too. All right. All right, so if you're looking at an herbal antibiotic approach that you could use to go after Lyme and Bartonella that gives you some flexibility, what I usually like using for that would be a combination of Japanese knotweed and Cryptolepis. And I would also, once you're stable on those two herbs, I would add in a capsule of something called cinnamon, clove, and oregano. Okay, all right. Let me show you where you can find that information. And let me just show you what you can look at to give you an idea what you're up against here, because I know it's probably very overwhelming for you right now. All right. So let me do a screen share here. All right. So I have an online protocol about where you can start. And even this looks complicated, but you can break it down into small bites. Okay. So any treatment protocol should have steps that deal with sleep. There's some diet recommendations I make. There's some steps you should take to protect the intestinal microbiome, including starting with herbal antibiotics first, okay? But then down here, you get into Lyme infection. What do you take? And what do you take for Bartonella Babesia, okay? Now look here in this Lyme infection part, and right here, this option 3, which is if you have Babesia, Bartonella, and Borrelia, here is an option that you can do that goes after all 3. And this is what I'm recommending for you to consider for Bartonella and Borrelia. That's the Cryptolepis, Japanese knotweed, cinnamon, clove, oregano. The Crypto, I would start at 1 drop 3 times a day and go up as you can. The knotweed, 1 drop twice a day and go up as you can. And somebody that's really reactive, okay? And this Cryptolepis here, when you're using it to treat Bartonella, I usually dose it I try to work up to 2.5 milliliters, not 5 milliliters 3 times a day. In fact, I think I say that down here. Let me see here. I guess I didn't say it here, but you can go half that dose I recommended there. Okay. All right. Those are some places to start looking at least. Okay. Good luck to you, Don. I know it's overwhelming. Probably everything I just said is very overwhelming too, but I want to let you know you don't have to go with prescriptives. You can go herbal and see how it goes. And the herbals give you a lot more flexibility in terms of how rapidly you try to kill things. Therefore, you can kind of control how you feel through this process. The other advantage of herbals is you're not destroying your gut microbiome. And for a lot of people, the herbals do just great. Okay. All right. Good luck to you, Don. Hello, Jennifer. Let's see. Dear Dr. Ross, my husband's quiet nature has become volatile and aggressive due to BART. Short fuse, as is mine. The Rifing report shows all 3 Bs for us. Dr. Krista, mold webinar, mentions cherry angiomas all over his back can be a sign of Babesia. Which herbs could you suggest for Babesia, and how long might it take to resolve? He is not cooperative, but visual improvements might convince him. Yours gratefully, Jennifer. Okay, so I would agree with Dr. Krista saying cherry angiomas could indicate Babesia, but I would caution you that also as we age, we develop cherry angiomas. So usually with Babesia, when it is significant as a sign of Babesia, you're going to see clusters of these things, okay? And even Bartonella can give you some cherry angiomas too, but not to the degree that Babesia can. So just finding cherry angiomas does not mean Babesia, but if you see a lot in clusters, think Babesia. Bartonella is a possibility too. So it's not as clear as if you just see them, okay? All right. And then in terms of what to use for Babesia, I like using, I'm just going to show you here because that way you can go back and look at this later here too. So I'm going to do a screen share. All right, so in terms of within my Lyme guides, I have a section called infection plans. And this gives you ideas of what to do for any kind of infection. So acute tick bites, chronic virus infections, Morgellons. Anyhow, I'll keep going through here. So there, I do have one on Babesia. This is my Babesia article, okay? And in here, deep within here, I do have a section on how do you go after this herbally, all right? So again, this would be herbal options for Babesia. The lead agent I like is Cryptolepis, and I try to work people using a 1 to 5 tincture, meaning the tincture is created by extracting 1 part plant and 5 parts alcohol, okay? And I try to work up to 5 milliliters 3 times a day for Babesia. If I want to be stronger about it, I will couple it with artemisinin. And the way I use artemisinin is I actually pulse it. You can read about it here. The reason I pulse it for 3 days on and take 11 days off is your liver develops an enzyme that can deactivate artemisinin. So we find it best to use it at really high doses or work up to really high doses for a few days, okay? Now, if this doesn't work out, then another combination you can do is you could do a combination product that has both Cryptolepis, Sida acuta, and Alcornia in it. Is another option. My preference, though, is a crypto artemisinin combination. Probably start with the crypto first by itself, okay? And I think that's what I said here. Yeah, so here's what I say. If you want to start initially, just go with our crypto 5 milliliters 3 times a day. If it's not helping symptoms by 2 months, then add artemisinin as the main change, or go to the CSA tincture. Okay, all right. All right. Good luck, Jennifer. Hello, Sheila. See, Dr. Ross, what is your protocol for mold? I have mold in sinuses and lungs and Bartonella and rickettsia. Also, what is your opinion of the Cowden Protocol? So I'll start with the Cowden Protocol. I don't find it to be that effective, to be quite honest. And I think that some of the herbs that are used within it are based on old science. Again, I think we have better science that I just described coming out of Johns Hopkins showing other agents that can create stronger protocols. So I'm not a fan of it, basically. I think you'll find it better if you follow my protocol. My protocol, I think it will get you better results and go down the and part of my protocol, which deals with sleep and adrenal support and regulating inflammation. You'll find a section in there about how to use herbal options for your Bartonella, Babesia, et cetera. So I'm not a big fan of Cowden. Okay, all right. Number 2. So basically, my approach to mold toxicity is to not assume everyone is colonized with mold in their sinuses or lungs right away. So I'm not sure how you're making that conclusion, but if you're saying I have mold toxicity, therefore it's in my sinuses and lungs, that's not necessarily true. So usually in my practice, I only have to resort to trying to put somebody on a mold spore killer about 20% of the time. 80% of the people in my practice, I get well just putting them on binders to remove their mold toxins. So let me try to explain what I mean by that, okay? So mold toxicity is a condition where you go into a building that has mold maybe growing behind the walls, maybe visible, but the main thing you're doing is breathing in the gas, the toxins, okay? All right. And those toxins get absorbed into your bloodstream. And if you happen to be one of 75% of people, 75% of us, our immune system will see those mold toxins and tag them with antibodies. And those antibodies will work. And then other immune cells will come in and break down those mold toxins that are tagged by antibodies. Okay. All right. 75% of us could go into a building full of a mold cloud of toxins, breathe them in, and our immune system antibodies working with our immune cells will do what they're supposed to do. Okay. And as an aside, that is why I do not like the new MyMycoLab test that basically is an antibody test, because all that it's telling you is you have antibodies. Having antibodies may mean that your immune system is working effectively at getting those toxins out. That's why I do not endorse that kind of an approach. And I'm very vocal about that as well, too. Okay. But 75% of us, we make antibodies and our immune cells break down those toxins. All right. 25% of people, though, their immune systems make ineffective antibodies. And those toxins then don't get broken down. They go to the liver next. The liver is supposed to clean them out, but it can't do it. And they get moved from the liver through the bile system out into the intestines as a fat-based mold toxin still, and they get reabsorbed right back into the bloodstream, okay? So in 80% of people, their problem is they have just acquired a bunch of toxins that they can't get out. There is a small group of people that when they were in that building that had mold toxins, inhaled some of the mold spores, and those mold spores set up shop in your nasal passages, in your intestines, maybe in your lungs. And then they start becoming a source that produces toxins, okay? So, but that's not everyone. I mean, if you read some of my colleagues out there, they're like just throwing out itraconazole and mold killers like it's candy to everyone that has mold toxicity. And that's not the right approach. In my practice, I only have to do that 20% of the time. And how I come to a conclusion to do that is I put people on binders first for about 6 months. And then I ask them, are they getting better? And I also go back and recheck their mold toxin levels. And if they're improving, then that means they're still probably not being exposed anymore in their home. And it may mean that they're also not colonized, okay? If they're not improving, I go back and I ask them to retest their home again to make sure they're not being poisoned by their home anymore. And then I start to consider that maybe they're colonized. We do not have accurate colonized tests. So we back into the diagnosis of being colonized. So if somebody's not getting better with binders by about 6 months and they're not feeling better, that is the time I might consider putting them on an itraconazole pill to kill their mold spores and also doing nose sprays to kill the mold spores. But I won't start there, okay? All right. And again, I absolutely do not believe in doing the MyMycoLab studies. I think that is giving a lot of people false impressions they're loaded with mold toxins and they just be maybe having an immune reaction that works, okay? All right. So my way of checking for mold toxicity is to do urine mycotoxin testing using either real-time or mosaic diagnostics, okay? All right. So then in terms of picking which binders to use, it depends on which toxins you have. If you happen to have a variety of toxins, then I like to use a broad spectrum binder. And the binder I would start with might be a product called GI Detox by Biocide Botanicals. And it has a number of different things in it, like silica, humic acid, folic acid, some clay, some charcoal in it that will bind up a variety of different toxins, okay? So if you want to take a look at how I approach this, I'm going to just show you my article that I've written about it. All right. This is my article, Mold Toxin Illness and Tick-Borne Diseases. Within here, I have a whole chart about how do you choose your binder, depending on which toxins are available. And I discuss that about using antifungals, although again, I don't think 80% of people you don't need to resort to doing that. Okay, so take a look here. All right, let me go back here. Good luck to you, Sheila. Hello, Dawn again. Let's see. My doctor is starting me. Sorry, everyone. That's quite a loud ambulance. I actually sitting in my apartment here doing this, and I've got my patio door open, and I just happen to be in one of the more dense urban areas of Seattle. But I left the door open because it's just a nice breeze coming in. We actually finally have summer here, but we have nice temperature summer. So anyhow, I apologize for the noise there if these things are picking it up. All right, my doctor is starting me on ketotifen, and I'm concerned because I take 0.5 milligrams Klonopin to sleep. I read the two can cause extreme drowsiness the next day and even dizziness. He said he wants to calm my mast cell activation first before even taking antibiotics. Also, you said the bacteria replicates every 24 hours, so I took Augmentin and then stopped it for 7 days. Does that bacteria grow stronger? All right, so Augmentin is an antibiotic that would work just against Borrelia, which is Lyme, and not against Bartonella and Babesia, okay? Borrelia, we think, replicates about once a month, so it's not going to come back quickly. I just want you to know that, okay? And I do agree, in people that are super sensitive, sometimes even before starting them on small amounts of herbal antibiotics, I might spend time trying to calm their mast cell activation. And often that means looking to see if they have intestinal yeast overgrowth, which can be a big trigger of mast cell activation. I'm also going to consider putting them on a ketotifen. And if they're having a lot of sensitivity, I'm going to start getting them to learn some mind-body techniques to calm down their reactivity. And that's something called limbic system retraining, of which I like a method called the Gupta program. It's a 3-month program where you learn techniques to calm all of that reactivity down, okay? So I'm going to show you some resources to look at because it might be useful for you to take a look at these, all right? And I'm going to go ahead and do that now. So let me just do a screen share here. All right, so, okay, this is an article I wrote about how to manage extreme sensitivity in Lyme disease or mold toxicity, okay? And so I do like trying to stabilize mast cells. Usually I'm going to go herbal first, though. I'm going to do quercetin, although I will admit ketotifen is an interesting way to go. I also like to go after intestinal yeast overgrowth, okay? Because yeast is a huge trigger of your mast cells. And then finally, I like to do something called limbic system training, which is a way of working with your brain to make it so that you're not as reactive to things. And the big method I like is this one called the Gupta method, okay? All right, and then if you're looking for more information about mast cell activation, I have a whole article about that. And I talk about all kinds of interventions here, including number one, decreasing stress. Stress is one of the biggest drivers of your mast cells. Trying to remove things that trigger your mast cells, decreasing infections when you can, removing toxins, lowering inflammation, and then there's a bunch of different antihistamines you can be on, including stabilizing your mast cells and working with an antihistamine called ketotifen here, okay? But anyway, it's a common, so take a look at this article. You may get some other ideas here too, okay? All right. Good luck to you, Dawn. Hi, Lynn. Hi, Dr. Ross. I just heard Dr. Horowitz on a webinar discussing using Dapsone, and the side effects are temporary and can be easily managed by taking folic acid, and any issues return to normal within a few months every time. What is your experience of that and its use in Lyme and Bart? Since I have positive Bartonella fish, otocoli fish, Microti IgM, he also said not to use Dapsone with a positive. I'm going to do this again. Since I have positive Bartonella fish, otocoli fish, Microti IgM, he also said not to use Dapsone with a positive Babesia test. And I wonder how long that needs to be treated and how to know when it's gone enough to try Dapsone. Last question is, suddenly my feet are bluish, feel very cold when I wake up, which comes and goes after that throughout the day. Is that Babesia related to circulation? And is that also why my hair is thinning? All right. So Lynn, so first of all, I'm not a big proponent of the Dapsone protocol. In fact, the main person that is the person that promotes the Dapsone protocol is Dr. Horowitz. I don't find many of us are using it these days, all right? Dr. Horowitz has published some studies making claims about the benefits of his protocol, but there's some problems with it, okay? So his first study was done using something called a low-dose Dapsone protocol, in which at that time he claimed good benefit. But when you got into the data, and this was data he collected in his office that he was the only one that evaluated, no independent reviewers, just Dr. Horowitz. And his data showed that about 50% of people had improvements, okay? Which sounds great, all right? But then when you start looking at the numbers, the improvements were modest. They were only about, I think, 5 to 10%. These were not great improvements. And he was out telling everyone this was the cure, all right? So number one, it doesn't add up. Okay, now his subsequent studies, what he did, he's developed his double Dapsone, triple Dapsone, 4 times Dapsone protocol. And what his starting point now is, all right, so, and then the other thing I should tell you, in his first study, about 50% of people had to drop out because they couldn't tolerate the side effects. 50%. That's pretty high, all right? So only 50% were completed, and the improvements were marginal, maybe 10%. This was not a wonder drug, all right? What he's done with his subsequent studies is his starting point is only people that could tolerate the low dose. So when he publishes data saying great benefit, you have to keep in mind he's already knows that 50% of people can't even take the low dose. All right. Second thing is, if you look at one of his protocols, Dr. Horowitz, how can I say this? There's not a nice way to say this. I'm just going to say it. Dr. Horowitz never saw an herb or a prescription that gave benefit in somebody's study that he decided not to put in a protocol. His protocol is so loaded with products and prescriptions that do the same thing as something else, that when we look at what the improvements are that people might get, it's hard to know if they're even coming from the Dapsone. So for instance, his 4 times Dapsone protocol and even his double Dapsone relies heavily on people taking something called methylene blue to deal with the side effects, right? But guess what methylene blue is? It's a great killing agent at Bartonella and Borrelia. So I think he's misnamed his protocol. I think with as much methylene blue as he throws at people in his protocols, it should be called the methylene blue protocol, because maybe it's the methylene blue that's working, all right? The last problem I have with Horowitz's protocols is they have not been independently evaluated. And it's Dr. Horowitz that goes through his charts on his own with his own bias. He's a cheerleader for Dapsone. It's his own bias that he's using when he interprets data. So I have no idea whether these protocols are valid. I did use the low dose protocol to begin with, and I used plenty of folic acid in it. And what my experience was is that about 50% of people did have to drop out. They couldn't tolerate it. The remaining group of people had varying degrees of side effects and varying degrees of success. I did have one person on a low dose protocol that actually got 100% well. The great majority, I found his treatment to be a failure and do not have, because of all these issues that I've just raised with you, I am refusing to go to the higher dose options with my patients. I will also let you know, as a practicing doctor that has to argue with my medical board from time to time, I could not justify in front of a medical board giving all those things that are in a Horowitz protocol. They would laugh at me. They would just say that's absurd. And the face value, I would agree with it too. So I'm not a big believer in the Horowitz Dapsone Protocol. So I just want you to know, and that's about the only thing I can say here. Okay. All right. And then I think there's better ways to go at your germs than a Horowitz protocol. I think it can be harmful, and I think his value is way overstated based on his own biases and the fact that he doesn't even publish a full data set, including people that couldn't take the drugs to begin with. Okay. All right. And then let's see. So your blue feet, sometimes in tick-borne infections, you can get spasms of your blood vessels. We call that phenomenon called Raynaud's phenomenon. Sometimes we'll see it in autoimmune illnesses. Sometimes you'll see it in tick-borne illnesses as well too. My approach, so sometimes wearing coverings to keep temperature fluctuations. So what happens in Raynaud's is temperature fluctuations, either getting hot or cold, sometimes will trigger these spasms. From a herbal medicine standpoint, I usually would like to have people on, I might use ginkgo biloba to help with it. From a prescription medicine standpoint, sometimes we're going to use calcium channel blockers to keep the blood vessels from going into spasm, basically. Okay? All right. Good luck to you, Lynn. Lynn, regarding the thinning of the hair, a few things to look at. So make sure your doctors have done a basic workup that we should do on anyone that has thinning hair. So number one, get thyroid studies, look at iron levels. Okay. All right. And particularly a type of iron, storage form of iron called ferritin. All right. The other thing to do is look at your medications. If you're on binders that use charcoal will pull a lot of minerals out that your hair needs to grow. So sometimes if you're on cholestyramine or you're on charcoal, you're going to have mineral deficiencies leading to hair loss, okay? The other thing is longer term use of azoles like fluconazole, itraconazole. Those drugs have a side effect of hair loss. So you've got to look at your drugs, do some thyroid studies, look at what binders you've been using if you're using them, and get some iron studies, okay? But if that all comes back normal, then my next approach is to use biotin. Biotin has a vitamin B8, and it helps support hair, okay? That would be something to think about doing. I also will say that I know there's a hair growth product out there called Nutrafol that has got it's basically a vitamin, but it's got some compelling data that would suggest that this multivitamin helps hair growth as well too. So you might want to take a look at that as well too. Okay. All right. Very good. Good luck to you. Patty says, hi. Hi, Patty. Hello, Nilafar. Let's see. Hi, Dr. Ross. If you have mold, compromised gut, and MCIS as part of Lyme and co-infections, which one do you address first? So it all depends. It depends. That's about the best I'm going to be able to say. I don't have a boilerplate response. So, for instance, if I've got somebody with all of these issues and I'm taking a history on them and they had a tick bite 10 years ago and they had a bullseye rash, but yet they didn't really get sick. They did well. And then when they recently moved into a home that was covered with black mold, that's when they got sick. I'm going to go after the mold toxicity first, okay? So sometimes the history will tell me which one I need to do, all right? On the other hand, if I've got a person that is extremely reactive, meaning anything I give them a whiff of it, they're going to react in some way, then I need to stabilize their mast cells first. And I need to possibly go after intestinal yeast, which is a big trigger of those mast cells. And I might put them on a Gupta program just to help calm their limbic system down, okay? On the other hand, if there's not really a lot of MCS going on and the history kind of says it was that tick bite that got them sick, not their mold exposure, I might go after Lyme and co-infections first, all right? I will also let you know, even though you might go Lyme and co-infections first, that doesn't mean within a month or two you can't start putting yourself on binders and going after the mold at the same time too, all right? So I hope that gives you some insights there, all right? Good luck. Hello, Lynn again. Hold on here a minute. With Babesia meds, is it reasonable to take Mepron and pulsed artemisinin without any antibiotics? And if tefenaquine is a bad idea with mast cell syndrome, I think you mean mast cell activation syndrome, with Oticoli, have you seen Primaquine clear Oticoli and other Babesia species as effectively as tefenaquine? What percent of it will clear with either of them? Okay, so the reason that we use so the studies suggest that when you use Mepron to treat Babesia, that we tend to get into some resistance unless we have azithromycin used at the same time, prescription antibiotic, okay? It doesn't necessarily mean that azithromycin is a great killer, but it helps limit resistance from developing, all right? Could artemisinin be a substitute for that? Maybe. I can't tell you in head-to-head studies how they work, because I usually tend to go azithromycin, Mepron when I'm going to do that, all right? All right, then. So there's a newer family, well, not a newer, there's a new wonder drug for dealing with Babesia oticoli, and that is called tefenaquine. Tefenaquine is in a family of antibabesial or anti-malaria medicines called the quinolines, and one of the quinolines is also called Primaquine, and Primaquine has been around for a very long time, all right? The major difference is Primaquine has a very short half-life. I think it's about a day, and it's out of you, versus tefenaquine has a long half-life. It takes about 2 weeks for half of what you take to get out of you, which means that it takes 4 half-lives or 2 months for all of it to get out of you. So the question I have brought up here before in helping my patients decide what to do is that if I've got somebody who's having strong mast cell activation, I do not want to put them on something that may be stuck in them for 2 months while they continue to just have their mast cells spiral out of control, all right? So my preference in my patients with mast cell activation is actually to do, is to go ahead and use Primaquine, which is shorter acting. To be honest with you, I don't know which one works best against oticoli. I don't have enough experience to tell you for sure, okay? All right, good luck, Lynn. Hello, Patty. Let's see, I'm still very off balance, and also it's difficult to walk more than a block without burning pain. I figure I have nerve damage, but I also guess I have to break Bartonella by going back on antibiotics. So neuropathy, I will tell you, so yes, you have neuropathy from what you've described here, okay? The being off balance and the burning pain, all right? I will let you know, in all people with neuropathy, we only ever identify an actual cause 50% of the time. So don't necessarily assume it's Bartonella. It could be, all right? In your tick-borne infections, the 2 tick-borne infections that can lead to neuropathy are Bartonella and Borrelia. So it could make some sense if you've got other symptoms besides neuropathy suggesting Bartonella, Borrelia, that you might want to cover for that, all right? The other thing is to add in some basic nerve repair, regardless of what the cause is. And basic nerve repair involves using a couple of things. Number one is glutathione. Glutathione is a master antioxidant that helps repair nerve injury and injury to your cell energy factories called mitochondria from the inside. The product I like for that is a product made by Research Nutritionals called Tri-Fortify. And that's because it's got great absorption data. They've got good data saying the stuff gets absorbed, okay? All right. And I would do a teaspoonful of that 1 time a day. And then I would combine it with another research nutritionals product called ATP 360, which has in it a bunch of phospholipid fats that are the same kind of phospholipid fats that make up your nerve cell membrane and the membranes of your energy factories in all of your cells called mitochondria. By definition, when you have nerve injury, you have injury to the mitochondria of those nerves as well too. And if the power factories of your nerves are injured, it's going to be hard for them to recover, okay? So ATP 360 with this phospholipid fat repairs injured mitochondria and injured cell membranes. In addition, the product has in it some micronutrients that help your mitochondria work better, like coenzyme Q10. And then it has another substance in it called pyroquinolene quinone, or PQQ. And PQQ promotes the growth of mitochondria, so you make more. All right. And so my mitochondria or my nerve repair regimen for people in situations like this that I usually recommend to my clients, my patients, is ATP 360, 3 pills 1 time a day, and then Trifortify liposomal glutathione by Research Nutritionals. And I recommend that at 1 teaspoon once a day. And I recommend giving it about a 6-month trial. Okay. All right. Good luck to you, Patty. All right, everyone. I'll take one more here. Let's see here, Catherine. Like, why would IGeneX be negative and T-Lab positive smear testing for Babesia? So, all right. So the T-Lab is a direct test. They're looking to see if you can see it under the microscope. And T-Lab uses a genetic material that attaches to the genetic material of the germ. That's called a genetic probe. And it has a fluorescing agent on it. Okay. So the T-Lab is known as a FISH test. They don't call it a FISH test. Okay. But that stands for fluorescent in situ hybridization, where they're using a genetic probe with a fluorescent marker to attach to the genetics of the germs. Okay. IGeneX also has a FISH test, and I wonder if that's what you're referring to, which also uses a genetic probe to attach to the germ. But they're using a different genetic probe. It's a different gene profile they're using. So maybe it's just not picking it up on the IGeneX, okay? Secondly, keep in mind that these germs sometimes are not in the sample of blood that you get drawn, all right? Because they don't live in every portion of the blood. So it may be that that sample that was drawn at different, even if it was the same needle stick, you would have drawn one tube first, handed it off, and they would put the other tube on. Maybe it was a different sample. The sampling difference as well too, okay? Finally, if you mean IGeneX immunoblot, so the immunoblot is a way of looking to see if you make antibodies against the infection, and it will miss it about 6% of the time, okay? All right. All right, everyone, that's it for tonight. I got to go out and move my knee around again. So anyhow, it's been good being with you here. I will be back again with you in 2 weeks. So I hope that you will take the opportunity tomorrow morning to sign up and share this with everyone, share it with your friends, see if we can get more people to join us here as well too, because I want to help people, help me help people. All right. All right. Good night, everyone.